This was different. I never really thought I was going to be an expert witness in this. I didn't even know the magnitude of what I was getting myself into. I mean, to me, it was about, did I help some patients? Yes. Did I play a small part in exposing the truth? Yes. To this day, Monsanto will contend that glyphosate is safe and Roundup is safe. Sure, that's lip service as far as I'm concerned. They can say whatever they want.
I know you've done a lot. You've done a lot in your career. You've had a lot of different experiences. And today's conversation is really focused on one particular time in your life and one that you've written a book about. So we will talk about that. But before we dive into that, I just want to ask you, tell us a little bit more about yourself and also what drew you to medicine in the first place.
Yeah, thanks, Stephanie. So I'm a hematologist and an oncologist. I took care of patients for many, many years. I did a lot of work in non-Hodgkin lymphoma in terms of taking care of patients as well as conducting clinical trials. And I was last at the University of Chicago until 2016. I subsequently got an MBA in healthcare management. I became really very interested in the healthcare ecosystem. And as I got into medicine, I started liking it even more. There's a human element to medicine that does not exist anywhere else in any other profession. In medicine, it's the only profession where you are trusting somebody who you're probably meeting for the first time in your health, the most precious thing in your life, at the most vulnerable moment. And that part of a human connection, what drew me into medicine more than the science. Then the science came along, and I became very interested in the scientific advances as well as the human nature. As an oncologist and as somebody who was an expert and is an expert in non-Hodgkin lymphoma, it is not uncommon to get calls by lawyers to look at malpractice cases or what perceived or potential malpractice cases. I've always said no. I really never had an interest in this. I never had the time. This was different. I never really thought I was going to be an expert witness in this. I didn't even know the magnitude of what I was getting myself into. Someone mentioned my name to a law firm in Virginia that was really suing Monsanto for their weed killer, Roundup, which is the most common weed herbicide used in the entire world. It is the most one that is used in the United States, obviously. And there was a report that came on in March 2015 that that the glyphosate, which is the main ingredient in Roundup, is a probable human carcinogen. And the linkage was most with non-Hodgkin lymphoma. So I was called by the law firm asking me what I think about Roundup and non-Hodgkin lymphoma and whether I would be willing to look at the evidence and evaluate the relationship and render an opinion. And I did. I thought to myself, for the most part, we often don't have an explanation why someone has cancer. As humans, the first thing that comes to mind when you go and see the doctor and when you have cancer, and Stephanie, you were a patient and you're a patient advocate, this must have crossed your mind. When you get diagnosed with any form of illness, the first thing you ask, why? Is there something I did? Maybe I could have done differently. It's normal. And most often, we tell patients we don't know. Most often we don't know because either we really don't know or the science just has not evolved enough to know. But I thought to myself, if there's a subset of patients that I could probably tell that maybe this was caused because of Roundup, then I would have helped that patient and their families. So yes, we don't know why lymphoma occurs in the majority of patients. And not every Roundup sprayer is going to get lymphoma, and not every lymphoma is caused by Roundup. To me, it was maybe some patients who have used that hazardous compound developed lymphoma because of their use. And if that's the case, I want to be part of trying to help these folks. So I've decided, and I agreed after I reviewed the evidence and I looked at everything, I thought to myself, I'm happy to help. I can tell you, Stephanie, I had literally no idea how big this was. I did not know what's going to happen. I've never been in a courtroom testifying as an expert witness. In hindsight, I think it was foolish I said yes because I was so overwhelmed, but it was probably one of the best decisions I've ever made.
Why do you think it was one of the best decisions you've ever made?
Because I helped some patients. I mean, to me, it was about, did I help some patients? Yes. Did I play a small part in exposing the truth? Yes. To this day, Monsanto will contend that glyphosate is safe and Roundup is safe. Sure, that's lip service as far as I'm concerned. They can say whatever they want. And yes, they've did a lot of settlements and things like that, saying we're just settling this, but we don't admit to any wrongdoing. It is what it is. But to me, what matters is that patients now are aware. People know. And we have scored some small wins. Monsanto is going to pull Roundup from residential use in 2023. The EPA is being asked to re-review the evidence. I think more people are aware of the harm of Roundup and what it could cause, and whether Monsanto admits or denies it's safe or not. As far as I'm concerned, more people are aware. I think that we know it is that there's net harm to the compound in what it does to patients at large. And if I played a small role in this, then I'm proud of it. And certainly the trials, and we'll talk about these, were not won because of me. I'm just one person. There's a team of experts way smarter than me, but I was part of this team and I played a small role. And if I helped one patient and expose and be part of the truth revelation, then it was well worth the fight.
You're saying we can never really, at this point, there's no link. It's not to say every Roundup, use is going to link to non-Hodgkin. Two-part question. One, what does it mean to be an expert witness on behalf of patients? And the second question is, what do you feel were the most powerful parts of your testimony?
I mean, an expert witness is somebody who has developed an expertise in a particular domain of medicine. So in my situation, my expertise was in non-Hodgkin lymphoma. What might cause non-Hodgkin lymphoma, how you treat non-Hodgkin lymphoma, the prognosis of non-Hodgkin lymphoma, all of these things. And, an expert witness is somebody who is willing to evaluate the evidence in a particular case, in a particular litigation trial, and offer an opinion within the scope of his or her expertise. So what I was asked is to read the medical records of these patients and look at their past medical history, at their exposure history, at what the treatment they got, the prognosis, and then render an opinion whether I believe Roundup was a substantially contributing factor in these patients developing non-Hodgkin lymphoma. I wouldn't be able to testify in breast cancer, for example, right? It's not an area of my expertise. I'm not an expert in sarcoma, but I am an expert in non-Hodgkin lymphoma or all lymphomas in general based on my track record, publications, and scientific contributions. As far as what I've learned in these trials is few things probably come to mind. I gotta tell you, Stephanie, that the one thing that I probably learned the most, which is pretty intriguing, is that the jury does not see all the evidence, which was pretty shocking to me as like a citizen. Like I'm thinking, So you've got these 12 people, sometimes 14 people, they're sitting in a box, they're spending a week, 4 weeks or 6 weeks. You guys show them everything, right? You guys show them everything so they can render an opinion. Well, it turns out that both sides, they fight over what they want to present to the jury. So the plaintiffs' lawyers want to show everything that's going to help them win the case. And Monsanto is going to say, well, no, you can't show this. And they have motions and they talk to the judge and they say, well, no, 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 no. And then the judge has to say, well, we will admit this into evidence so you can show it to the jury, or you can't admit this into evidence. And sometimes, a lawyer would say something and then the judge would say, well, ignore this. You can't really, this is not something that you're allowed to consider in your evaluation. So it's pretty interesting. I did not know that this is the case. The other thing, I've always thought that there is a strategy in these lawsuits. So the lawyers really must know their thing, and they have to be convincing. The opening statements are important. The closing statements are important. The way they cross-examine is very important. There's so much strategy. And I hope that facts are always the most important part in any trial. But I actually think strategy in some trials trump facts. I think if you strategically know what you're doing in some of these litigation trials, you may be able to win the jury to your side, despite the fact that you may not be the truthful side. So, a lot of these things, I'm like, I'm naive to the courtroom. And I've learned also that I am very scared. I was trembling walking into the stand. You have no idea. I was not, I believe it didn't show because I was trying to be composed, but my heart rate was going 120 to 130 beats a minute. And hopefully folks did not realize how nervous I was. So I was really scared. I didn't know what to expect. I didn't know the magnitude of this. Monsanto has deep pockets. They were lawyered up. They had the best lawyers out there, but the team that was defending the patients was also very good. They were extremely good. They were dedicated. They cared for their patients. They put a lot of time, effort, and money into it. And I felt I was in a chess match, which is my goal is not to really impress Lombardi or impress even our lawyers. My goal is to really win the jury. My goal is to make sure that the jury understands the facts. And that was really my goal. So I was really very nervous. I had no idea what to expect. And I did not think that patients stand to win against this major corporation. It felt like David versus Goliath. Again, I don't want to really give a lot of metaphors. I don't want to really blow things out of proportion, but honestly, it felt like this. You've got this large corporation that has never been taken to court for Roundup, was just bought by 60 or 66 billion dollars by, or 63 billion dollars by Bayer, the large pharmaceutical company. And so I was very skeptical what's going to happen, but I'm very happy that truth prevailed and justice was served at the end for these 3 trials. It felt so personal to me. Look, I know that the trials, like we said, they don't really won by one person or lost by one person, but to me, it felt personal. Maybe because I don't do this commonly. Some folks probably do this for a living. I don't know, but I don't. So it felt really personal. So then when the defense rested, obviously the jury starts deliberating. And I remember that every day I would check in with the lawyers and I check the outlets, and they're still, I forgot whether it was 3 days or 4 days that it took to deliberate. The longer it takes to deliberate, the more anxious I was getting, because I was thinking if it was slam dunk, they would have said right away. I really don't remember exactly how long it took them, but I remember the date of the verdict was August 10, 2018, almost 5 years ago. And I was driving here in the suburbs of Chicago, and I saw, sometimes look at Twitter and other outlets, and I saw that the judge announced that the jury has reached a verdict. And I pulled over, and I just keep refreshing my phone, because I didn't know where to find the news. But as you know, everybody was watching the trial. Every outlet. It was the first trial, so it was really taking a lot of attention. And then the verdict was yes. They were guilty. $285 million were awarded to Lee Johnson. Of course, it went down afterwards. I cannot describe how happy I was. I was beyond happy because I was of the mindset that if we lost, we were going to lose because of me. And if we won, we're going to win because of the team. I felt that it's me. Because I was the last witness on the stand for the plaintiffs. And I really felt so much burden that I was the one who was going to try to synthesize everything to the jury for that particular patient, because the prior witnesses were talking in general, toxicology and animal studies and statistics and so on. I was talking specifically about that patient, the case specific. It was such a relief because I felt that I did not fail Mr. Johnson. I did not fail at the end of the day, what gets lost in translation between lawyers and all of these things is the person who is the most important. And the person that is most important is the patient. And I felt great. I cannot tell you how happy I am. It's hard to describe my body language in the car when I actually was extremely happy, but it was like, yes.
How were you able to, like, what were your main messages in trying to prove this? Now, I know this is specific to Mr. Johnson's situation, but I think a lot of people, including our audience watching this, are going to want to know, well, how am I supposed to figure out, or how's my doctor supposed to figure out if this was the cause, or at least part of the cause of the situation of me getting cancer?
This is an excellent question, and this is a question that everybody should ask. I would, my message to your viewers and listeners, ask questions. There is no question that is stupid. You must ask questions. This is your life, your health, and you should be empowered to always ask questions. And if your doctor is not willing to even entertain your question, get another one. The doctor is there to help answer your questions. So the way I would approach any case is by thinking, what do we know about what causes non-Hodgkin lymphoma, right? I mean, we already know that there are certain things that have been proven to be associated. We know some drugs that could cause increased risk of non-Hodgkin lymphoma. These are immunosuppressive drugs. So folks who are on drugs that brings their immune system down could have increased risk of non-Hodgkin lymphoma. You see that in some autoimmune diseases. So folks, let's say, who have Crohn's disease or ulcerative colitis, they get medications that lowers the immune system. Because remember, these diseases are autoimmune. So the immune system is very active. And if you lower the immune system, you could actually have non-Hodgkin lymphoma. There are other reasons why, folks. So I go through all of these reasons. I was always taught that farmers have increased risk of non-Hodgkin lymphoma because of pesticide exposure. But I admit I did not really have a lot of knowledge specifically about Roundup, but I've always known that pesticides and farming increases the risk of non-Hodgkin lymphoma. So, I go with the jury. I say, I looked at this case. These are the risk factors. In the Johnson's trial, even in the Piliad's trial, I had a whiteboard that I showed the jury, and I drew on it. I said, number one, number two, these are the risk factors. And I told the jury, when we don't find any of these risk factors, we call the cause idiopathic. That basically it's a word that we don't know what causes it. And the largest, the highest percentage for folks with lymphoma is usually idiopathic. We don't know. But we have to go through these risk factors. So that's what I do.
Like, did you find yourself having to contend with, the cross-examination or with the other side trying to needle you because of all these variations and opinions? And what do you do when the data out there seems to be so different? It's hard to pin down, it just seems like a big hill to climb.
It is a big hill to climb. And, science is not perfect. Science is not perfect. Our job is to take care of patients and help patients despite imperfect science. If you are waiting to get 100% confirmation of something, then you've never taken care of patient. You've never actually understood science. But you're right. Monsanto's playbook has always been, well, wait a minute, are you really smarter than the EPA? But my job was to ignore the noise and evaluate the science independently. So, if I'm going to just take everything that the EPA says at face value, then I think we have a lot of examples in history where the EPA has been wrong, or the FDA has been wrong, or the CDC has been wrong. The goal here is to really evaluate the science independently and make sure we serve patients. But yes, Monsanto will always contend this. Then they will contend that they've done gazillion studies and all of the studies were safe, but they did not publish them because they are trade secrets. Well, great. So we have to take your word for it, I guess. If you tell us it's safe, then we'll just believe you because it's trade secrets. Well, that really doesn't make sense if you're a patient that you think you've really been harmed. And that's really important. I'll leave you with something provocative as well. So the initial studies, the toxicology studies, were done by a lab in Illinois, actually in Northbrook, Illinois, close to where I live. It's called IBT Labs. And IBT Labs turned out to be fudging data. They actually were making up data. So some of the studies that glyphosate was done in that lab were completely wrong. And other companies that used that lab also were harmed by this. And the folks who operated the lab were eventually prosecuted. But they never repeated these studies. So you've got some studies that said that toxicology is fine, and they were really the fraud studies because the lab that performed them was a fraud lab. So there's a lot of things that occurred. It's easy to say the EPA said it's safe, but then our goal is to really investigate whether the EPA did a good job and is it indeed safe or it's not. And if we don't do that, we are not doing our job and our due diligence.
Again, for people who are wondering, you said ask questions. If they're like, hey, I've used Roundup, I've used it 20 times in this last year, just I think trying to have an understanding of how do I get from knowing this to actually getting someone to do something about it other than a law firm.
You have to look at the totality of evidence. Let me give you a thought experiment. The only 100% proof would be, right, Stephanie, if I take 100 people, put them in a room and spray them with glyphosate and Roundup, put 100 other people in a different room and don't spray them, and say, I'm going to follow you both for the next 10 years and see who gets cancer or not. That's not going to happen. It's unethical. You cannot do a randomized controlled trial in a hazardous compound where you think you may induce harm. So what we're left with is what we have in terms of science, some retrospective studies, all of these things. But the answer is yes. You have to look at the medical records of a particular patient. You have to look at what are these risk factors in this particular patient that may have led to the development of non-Hodgkin lymphoma. What I've learned through the Roundup trials and through reviewing the evidence, that the more somebody gets exposed to Roundup, the more likely they are going to develop the lymphoma. So the higher risk, so the higher exposure, the higher the risk is. That's really what I have learned. So, we have to take that into consideration in addition to the collection of evidence. But the totality of evidence is great, is very important. You have to know, what does glyphosate cause? We have a lot of data that glyphosate damages the cells, damages the chromosomes, causes cell breakage. So it really induces some damage into the DNA of the cells. And you know that this eventually leads into cancer. So yes, any patient out there, they really need to be their own advocate. And I think the physicians need to evaluate the evidence. What I can tell you is most physicians are very concerned about the treatment and what can I treat patients with. Same for me when I was called. So Monsanto, one of the playbooks of Monsanto will be, well, Dr. Nabhan, as you know, Mr. Johnson had many doctors, but none of his doctors, none of them suggested that Roundup caused his non-Hodgkin lymphoma. Well, yes, because they did not investigate that. I mean, if you don't really study the subject, you're not going to find this out. Had they studied what I did, they would have found this. So I think the idea is that playbook is, well, the doctors did not really know because the doctors did not really study and evaluate the evidence. They were just wanting to treat. And some folks are more interested in the treatment as opposed to anything else. So for the patients who are viewing this, ask questions, and the doctor needs to hopefully understand the evidence. And And maybe it's related to Roundup, maybe it's not, but I do believe that an expert healthcare professional needs to provide an opinion on that. Look, at some point, smoking was fine. At some point, you had ads on TV all over about smoking. At some point, doctors in the hospital, when they are seeing patients, they were smoking. And then science evolved, and we found out it's actually not good for you. It causes cancer, and now it's there, and people know if they smoke, they are increasing their risk. The same thing applies here. We may have thought it was safe 20 years ago. It is, in my opinion, counterintuitive and counter-science to assume it is safe in 2023. And I think we need to acknowledge that. And at a minimum, we need to tell patients and put a label on it. And unfortunately, we don't have that label. But as a physician, as a human, as a patient, I would have loved to see a label. Use it if you want, but it is a probable carcinogen. So you are making a choice. You are making a deliberate choice if you want to use something or not. And if you do, at least you know you have to have very protective gears and make sure that it doesn't really affect your skin or anything like that.
Thank you for this. My last question is about the book. Please tell us, what you're hoping, will happen as a result of you publishing this book and getting out there to the masses, and then tell us where we can find it.
Thank you. So I've decided to write the book to really tell the stories of these 3 trials. I think the book describes the stories of these 3 trials. These were the trials where I was the case-specific causation expert, and I testified, and all of these trials were won. So my goal was to hopefully reach more people, to make them aware of the trials, and to make them aware of Roundup, and to make them aware of the fact that Roundup is not good and it's really causing harm. I'm hoping people are going to actually benefit from this. That's really my goal.
It certainly sounds like a labor of love, not just the book itself, but what you did and committed yourself to some years ago. And as a patient and advocate, I also want to say thank you for all the years of work you did and for advocating for patients. I have no doubt that you played an instrumental role in these good verdicts for the patients. And we'll make sure to drop a link to your book. So thank you so much, Dr. Nabhan.
Thank you very much, Stephanie. And what you're doing for patients and families is something that is amazingly valuable. And I check your work, and it's just amazing what you do. So thank you for what you're doing. Patients do need you. Thank you.